I am proud to have served as a volunteer and recently as co-chair for UNA Women. I am delighted to be with you today as part of this dialogue on how COVID-19 has impacted the lives of women and girls in the US and all around the world. You will soon hear from our guest speakers, after which there will be time for questions and answers from the audience. If you have any questions at any time, please type it into the Q&A box, which can be found at the bottom of your screen on your navigation bar. Selected questions will be read aloud to our panel as time permits. Please note that the chat box will not be monitored, but you can access a link for speaker bios within the chat box. And now, it is my pleasure to introduce today's moderator, Seema Jalan, who's the Executive Director of the Universal Access Project and Policy at the United Nations Foundation. Seema?
Thank you so much, Himaja, and for the kind introduction, and to everyone who's tuning in and taking the time to join this important and timely conversation. As Himaja mentioned, my name is Seema Jalan, and I'm the Executive Director of the Universal Access Project at the UN Foundation. And our vision is a world where all people can realize their sexual and reproductive health and rights. It's our privilege to partner with our colleagues at UNA-USA and UNA Women for this timely and important discussion, and to be joined by such a fantastic panel, who I will introduce shortly. And since our host is UNA, I thought I'd start by sharing that the United Nations Secretary General Antonio Guterres joined the world this past Saturday in honoring Nelson Mandela on what would have been his 102nd birthday, with a global call to action on what he referred to as the inequality pandemic. And so I quote, "COVID-19 has been likened to an X-ray, revealing fractures in the fragile skeleton of the societies we have built. It is exposing fallacies and falsehoods everywhere. The lie that free markets can deliver healthcare for all, the fiction that unpaid care work is not work, the delusion that we live in a post-racist world, and the myth that we are all in the same boat. Because while we are all floating on the same sea, it's clear that some of us are in super yachts while others are clinging to the floating debris." And he goes on to note two of the historic sources of inequality in our world: colonialism and patriarchy. So while it's clear that the COVID-19 pandemic affects every single person on the planet, girls and women, especially those living in poverty or who are discriminated against because of the color of their skin or their sexuality or abilities, are uniquely impacted. The United Nations also released a report just last week outlining how COVID-19 threatens to reverse years of hard-earned progress on the Sustainable Development Goals, and particularly with regard to gender equality and women's health. Unless urgent action is taken, the report indicates that more women will not be able to control their own bodies and fertility, die giving birth, and more babies will not survive infancy. More girls and women will be at risk of assault, abuse, and harassment. More girls will not return to school, will marry during their childhood, and experience female genital mutilation. More women will spend more time on unpaid work, and all of our progress in women earning higher wages and seats at higher decision-making tables will be stalled. But let me be clear, and I'm sure my panel will agree with this is not about girls and women as victims. Yes, we are hit harder by the pandemic because of structural inequalities, but we are also hitting back harder. We are instrumental in fighting the virus and keeping the world afloat. And it's no wonder that the Secretary General has also made it a strong call to all countries to put women and girls at the center of COVID-19 recovery efforts. And we need action from all sectors. These solutions must be driven by women for women. And the women's movements, as usual, have already been stepping up to lead the way. I'll just share two examples. One is that more than 1,600 representatives and organizations from around the world have endorsed a comprehensive set of recommended action for governments, a shared roadmap. And this was initiated by women from the Global South and marginalized Northern groups. Another is that local women's funds across 173 countries have come together on a joint call to action to dismantle systemic racism and unequal power structures within philanthropic organizations, recognizing that there is no gender justice without racial justice. So these are the types of calls we must heed in responding to the crisis. So with that, let's dive in to hear what our expert panel representing different perspectives of the women's movement has to say. So I'm pleased and delighted to introduce Verónica Simán, the Colombia representative from UNFPA, Caitlin Horrigan, the Director of Global Advocacy at the Planned Parenthood Federation of America, and Maliha Khan, the Chief Programs Officer at the Malala Fund. So welcome to the panel, and we'll start by hearing from our panelists and then open the floor for audience Q&A. So let me begin by asking all of you the same question. As we know, girls and women are disproportionately impacted by COVID-19, but also essential to the response. What impacts are you seeing, and how is your organization responding? And how does your organization integrate racial justice as part of your approach to gender equity and beyond? So let me start with Verónica.
Thank you. Good afternoon, everyone. Thanks to UNA-USA for the invitation to participate in this panel and address such a relevant topic. Gender gaps and inequalities that exist are accentuated, compounded, and deepened during the pandemic, while the institutions are trying to adapt, to adjust their response to the current situation. Thus, women who are traditionally in challenging environments, the situation is accentuated. And let me go through some points where we can see this, at least in Colombia, and I think in many other countries around the world. The burden of unpaid care work in their household is increased. With the lockdown, school being taught from home virtually, that is affecting or increasing the burden on women. Also, there is greater risk for gender-based violence because often the women are with the aggressor inside the home. So, and this is something that we have seen in Colombia, data that monitors the phone calls on domestic violence to a hotline increased 148% between March 25th and July 9th. So it is a reality. We are seeing more reports related to domestic violence. There is also increased barriers to access sexual and reproductive health information and supplies because of competing demands. And it's very tempting for health services to focus on the pandemic and forget about other essential services. Women are also more likely than men to hold informal or precarious jobs, and they are being affected by the pandemic, by the lockdown, which limits the possibility of women to go to the streets to sell their products, their crafts. And so it's affecting them in a reduced income. Also, there is an issue of intersecting forms of discrimination. If the girl or if the woman is also a person with a disability or an indigenous woman or an Afro woman or is part of the LGBTI community or it's a migrant, then there are multiple forms of discrimination that are compounded. And then lastly, I'd like to refer to the fact that globally, most of the workers in the health sector are women. It's over 70%. Thus, they are in the front lines and more exposed to the pandemic. What is UNFPA doing in Colombia? Well, we've adapted our response to the current context. Thus, we are updating roadmaps on what services are being offered, because we have seen a decrease in some of the NGOs or other instances that are offering sexual and reproductive health or gender-based violence prevention services. And we have to do this with community leaders and other actors at the local level. We've also worked on preparing guidelines for psychosocial services, and also for protocols for remote management of gender-based violence cases. Because we have to reduce the contact, and going to the territories mean that we have to make sure not only that we're not gonna get the virus, but that we're not gonna bring it to the communities. So try to minimize presential care, and when possible, provide it remotely. So we have prepared protocols to focus on what measures they should be taken into consideration. We are also continuing to train personnel to ensure that they are taking relevant considerations and they are coordinating their response on gender-based violence. We have also trying to ensure the minimum standards in the response. It's not only, let's say, I'm gonna, take care of this person, but I have to ensure the quality of the care and the prevention services we are providing. We also are bringing gender-based violence services to women and strengthening networks that contribute to prevention. We are sending messages through different channels to try to ensure that they will reach all kinds of women. And when you were mentioning, racial justice, we have to make sure that we are doing it not only in Spanish, but in indigenous languages. We have to make sure we not only use social media, but we use traditional ways, like having the guy in the motorcycle with the speaker and the microphone, so that the messages are reaching across.
Thank you.
Yeah, we could go on, there are other things, but I'll just focus there. Thank you.
Thank you so much, Veronica. And with these, we never have enough time, but you've started us on something so important, which is the response on gender-based violence and on sexual and reproductive health. Let me turn to Maliha to hear more about what's happening with education.
Yes, thank you, Seema, and thank you, UN Foundation, for setting this panel up, which is a really important topic in discussion. So obviously, the biggest thing that's happening as far as education is concerned is schools are closed. So at one point, almost all the children in the world, and this is the first time in recorded history that we know of, are not going to school. Now, of course, this is starting to change in various different places, but for the most part, we know that most of the school children in the world are going to miss between 2 to 6, 8, 10 months of schooling. And when you start to consider the most marginalized groups within these, in the low-income countries and the marginalized and vulnerable groups within those, when their total years of schooling are 2 or 3 or 4 or 5, then this is a huge, substantial part of their educational experience. And then many countries are trying to do a sort of alternative education response. Unfortunately, there's a huge turning to digital media platforms for this, putting out apps using digital classrooms and other virtual things. This has, of course, enabled the better off students to be able to take advantage of this. But the more vulnerable students, the more disadvantaged students who don't have access to digital technology, or if they do have access, they only have perhaps one shared laptop at home, which also has to serve multiple uses. And then when we consider the most vulnerable, they don't have any digital technology at home. And particularly girls amongst this. We know that the sort of digital divide between boys and girls is tremendous. In South Asia, it's calculated that a boy is 3 times more likely to have access to some form of digital technology, whatever it might be, smartphone, feature phone, etc., than a girl is. And girls have to negotiate that access through various other people, which means that their ability to access these alternative forms of education is severely compromised as compared to anyone else. The second sort of repercussion that's coming from that is one of the biggest indicators of girls staying in school is them performing well at school. So the further a girl falls behind in her education, the more likely she is, particularly the ones who are struggling to get there in the first place, who are struggling to stay on due to multiple family pressures for finances, for her time, her care duties at home, etc., the more likely she is to be pulled out of school or never sent back to school. So we're estimating that a very large number of the most vulnerable, the poorest, and most marginalized of girls will never get back to school. And I can speak about that a little bit later. So the impacts we're seeing are girls dropping out of school, their reduced learning and their reduced access to alternative forms of education. And then, Veronica's already spoken about the impact of domestic violence that's within the home that, of course, girls will be facing tremendously as they, whether they're facing it directly or they're being exposed to this environment, which is going to add to psychosocial impacts. And one of the other things we also know about, particularly adolescent girls, is that school is not just for learning, it's also for socializing and having a cohort of their friends, which is what kind of, in many of those years kind of keeps them sane. I'm sure many of us can relate with that. And being cut off from that and not having the ability to connect actually affects, we know it affects girls more than it affects boys, because boys have the ability to go out and connect with others, whereas in a lot of contexts, girls are kept away from that. So what is Malala Fund doing with this? In all the 8 countries that we're operating in right now, we have immediately done a few things. The first thing we did was think about our grantees and to grant them as much flexibility as possible in their operating. We have to remember that these are also organizations that are out there that whose other funding might have been cut, who are struggling themselves in very, very difficult operating contexts. So we've tried to be as flexible a funder as we can possibly be. We've also immediately put out a number of different grants with people who are ready to offer alternative educational means that are equitable. So using radio, using television, using paper-based. We have one grantee who's just photocopying lessons and getting the post to actually take them to the most vulnerable groups and saying, can we do lessons that way? And then, of course, we are also ramping up our campaigns to get girls back into school once schools start again. And then one other thing I'll talk about later is the fear that governments will stop spending on education. Their incomes are going to be reduced, their budgets are going to be reduced, there's going to be a huge focus on health, which absolutely there should be, but we fear that that's going to mean that education gets a hit, and we would really like to make sure that governments keep an eye on that so that these tremendous advancements that we've made over the last decade, we don't fall back on.
Thank you so much, Maliha. And I think part of the point of this panel is to showcase the fact that all of these issues are connected, right? Education drives health outcomes and health outcomes drive education outcomes. So thank you so much. Let me turn it to Caitlin.
Thank you, Seema, and thanks to UNA. Greetings from Washington, D.C. And for those of you who might be tuning in from here, we're having a very dramatic storm. So apologies in advance if any of my remarks are punctuated with some dramatic thunder, although this is an important topic, so maybe it will be welcome. But I think for me, I want to highlight that this global pandemic, I think, highlights 2 important truths. The first being that sexual and reproductive health care is time sensitive and essential. And the second is that the weight of the pandemic, and I will say this worse than your Secretary General, Seema, but I think the sentiment is similar. The weight of the pandemic is not equally shared among us, and that it has really magnified existing inequality and disparities. And particularly when we look at the health impacts of systemic racism in the US, you see that profoundly illustrated in what we're seeing play out in the COVID response. So let me unpack those and dig in a little bit to the first one, that sexual and reproductive health is essential. I think we are hearing from our global partners that, no surprise, the demand for things like family planning, for reproductive health, for maternal health is not decreasing in this pandemic, and in some cases is actually increasing. And that shouldn't be a surprise because, of course, we know that people don't stop having sex, they don't stop being pregnant, they don't stop having reproductive needs, even in a time of crisis. But what we are hearing is that there are new and added barriers to people accessing the care that they want and need. And we know that in many places around the world, they already faced huge uphill battles to accessing that care, and the challenges are now all the greater. To build on, I think, some of the things that Veronica was describing, we're hearing instances, of course, of facilities being shut down who are being deemed non-essential. And so all of a sudden access to contraceptive care, for example, is disrupted because that center is being shut down. We've also received reports of instances where curfews are resulting in harassment of healthcare workers. You know, healthcare workers do not work always conventional 9 to 5 hours. And so there's difficulty with them trying to traverse to do their vital and important work and receiving harassment. We've also heard reports of travel restrictions, particularly impacting young people and girls in particular, who already face sort of stigma about being out in the world and accessing their health care. So that burden is often felt, particularly with adolescent girls. And then, of course, there are the economic barriers as economies suffer, as job loss hits people, and all of a sudden folks are juggling just a bunch of competing needs and having to weigh maybe contraception against putting food on the table. And those anecdotal stories, I think, that we hear from our partners really risk having such a dramatic impact on scale. And I think our colleagues at UNFPA put out some really important data looking at within a 6-month period, if these lockdown related disruptions could play out, it would leave 47 million women in low and middle income countries without access to contraception, which is estimated to result in 7 million unintended pregnancies. So really the scale of the impact of this new world that we're living in is quite dramatic when it comes to sexual and reproductive health care. And I think it's important to think about reproductive health care in this context, because we know for many women and girls that is their entry point to the healthcare system. It's the place where they count on going once a year, and really is a starting point to have any number of health conversations. So the sad work that some politicians in the US and other countries are doing to really shut down that entry point to care is all the more dramatic, not just for reproductive health needs, but for our ability to respond to a global pandemic and to get people connected to any number of care, treatment, and prevention that they need. Yeah. So at Planned Parenthood, we've seen multiple states in the US use sort of the cover of the pandemic to try to claw back and restrict access to care. We've seen the US Congress try to expand abortion restrictions on COVID supplementals. And we've even seen senior officials in the Trump administration try to bully our colleagues at the UN into pulling language about sexual and reproductive health care out of their global humanitarian response.
Thank you so much, Caitlin. I apologize for cutting you off. I hope we can hear the rest of your answer at a later point. Sure. But just to say, one of your colleagues said it really well too, that it should never be up for debate to trade away women's access to healthcare. So thank you so much for starting us on that conversation. Let me turn it back to Maliha. Malala Fund recently released a report on the short and long-term consequences of COVID on girls' access to education, as you've already referenced. Can you say a little bit more about what these consequences are and how they will play out? And I'll just note for the whole panel, because we do want to make sure we hear from our audience, that we're going to do these as lightning round questions. And so I apologize in advance for interrupting if I need to. Over to you, Maliha.
Sure, really quickly. It's a really long report, and I think it's going to be sent out, but very readable, so not to put other people off. And it'll be sent out, I think, after this panel to all the participants. So Malala Fund did a report based on the research we did during the West Africa Ebola crisis, looking at the impact of school closures and the epidemic there on girls' education. And based on the findings we found, the investigation we did in Sierra Leone and how many girls, stayed in school, came back to school, how many dropped out of school, and what were the reasons, we sort of extrapolated that to see, well, depending on how many countries close down schools, what is the impact on girls' education going to be? And the finding we found is that almost 20 million girls are in danger of dropping out of school. I know the previous report said 10, we've had to recalculate that, and it's actually 20 million is our new calculation. And that's based on the fact that, some of the things that we've mentioned already, girls not being able to go back to school because of financial pressures on families, their need for their labor at home to care, for the increased care at home that'll be needed. Girls falling pregnant or getting early marriage, depending on which context you're operating in. It's both are results of the same sort of factors and pressures on girls, and them not being able to go back to school because of that, as well as gender-based violence, psychosocial impacts on them, etc. One of the other really big things we're fearing about the pandemic, which I already mentioned, is government's financing of education. And we're estimating that there's going to be an even greater need to invest in education, but there's going to be even less incentives and abilities of government to be able to do that. So our key sort of things are keep girls in school, keep schools safe for them, push to have girls re-enrolled in school once schools open up, and keep funding education, particularly for girls. It's really, really vital.
Yeah, it's a core element of long-term recovery. We'll lose a whole generation. Thank you. Let me turn back to Caitlin, and I hope you'll be able to finish any thoughts from your prior question, but also add to it around, we're both in the United States, cases of COVID are spiking all around us. Why should Americans care about what's happening to girls and women globally when there's so much that still needs to be dealt with here?
Yeah, I think bottom line, and I think this pandemic has illustrated, is that we live in an interconnected world. And so we can't really hope to eliminate it here and act like our border means something without eliminating it everywhere. So I think the health and lives of women and girls in the US are intimately intertwined with what women and girls around the world are experiencing. So it's important for the US to stay invested and active and engaged in the global pandemic response, so that we can be working and learning from and building off global partners who may be doing it better than us, but also who we can contribute to really squashing it worldwide. And I think it shouldn't be controversial to say that an effective response should be built on global cooperation and coordination and be evidence-based and rights-based and grounded in data. But we know that our government struggles deeply with those things. And it's been incredibly short-sighted to see global response undercut and attempts to slash it to focus inward. Those things to me are not mutually exclusive, and we can and should do both. So it's been disappointing to see, from the get-go of this administration, the defunding of UNFPA, which obviously is hamstrung our ability to respond meaningfully to a crisis like this, and particularly the impacts on women and girls. And more recently, of course, with the withdrawal from the World Health Organization, another example of a short-sighted withdrawing from the world. And I think bottom line, us pulling back from the world hurts Americans, and it hurts women and girls everywhere.
Thank you, and you're already getting questions from the audience around this, so we'll definitely be coming back to that. Let me turn to Veronica. You mentioned that one of your focus areas is working with migrants and refugees. And even prior to the COVID-19 pandemic, UNFPA was providing critical SRH, sexual and reproductive health services, to Venezuelan migrants and refugees living in Colombia. So can you say more about how COVID-19 has just exacerbated the needs of individuals who are already in crisis? Back over to you.
Thank you. Yes, I would just like to say that we have in Colombia about 1.8 million Venezuelans who have arrived in the past 3 years. And in addition, we have Venezuelans who travel back and forth, who live in Venezuela, but come to Colombia for services, for procuring goods. And so this has been very much impacted by the pandemic because the borders were closed. So it is more difficult for those that come back and forth to travel to Colombia. And so they have to walk longer distances, or they have to cross, they have to go through these illegal cross points just to reach health services. So sometimes they will say, for example, the pregnant women, she may decide, I'm not going to go for prenatal care, but for the delivery of the baby, I will take the risk of go through the border. And so we have seen, there is a risk of higher complications in pregnancy for women. There is also the risk of not having enough contraceptives. And as it was mentioned earlier, there are a reduced availability of health services in these border areas. So that means that it is more difficult for women to reach those places. Sometimes they are afraid to visit health services because they're afraid that, they will get the virus. So they say, no, I'll wait. And so there is a risk of an increase in unplanned pregnancies. And in addition, we have indigenous populations and other ethnic racial minorities that live in these same areas, that they have confined themselves in these rural areas, and they have higher difficulty of accessing basic health services. Or they used to have medical missions visit, but now they're not traveling, there's limited mobility. So these mobility restrictions are really affecting women's access to health services and to gender-based violence services too. Over.
Well, sobering statistics, and all the more important that UNFPA has the supported needs, and disappointing that the US government has decided not to fund UNFPA this year for the 4th year in a row. So with that, let me turn it over to Himaja and London to hear from the audience.
Thank you so much, Seema. Thank you very much. And I'm going to ask the first question, and it is from Grace. And this question is for Veronica. Has the U.S. administration's decision to withdraw funding again for the 4th time had impact outside of U.S. borders and countries where UNFPA works?
Yes, it definitely has affected us. And the U.S. is the largest funder for the humanitarian response to Venezuelan migrants in Colombia. But UNFPA cannot receive any of these fundings. So this means that we are reaching fewer women. We cannot reach as many women as we would like to because we don't have as much funding. In addition, we have a situation where sometimes this U.S. funding goes to organizations that they are not necessarily experts on sexual and reproductive health and gender-based violence. And some of these organizations try to approach us. And actually, a couple of weeks ago, we were approached by one of them. They wanted us to give us funds to implement some gender-based violence prevention and care activities. But because of norms, we cannot receive, actually, the US cannot give funding to UNFPA, so we weren't able to do that. We can collaborate, but we cannot receive funding. So this presents barriers in reaching more women. And finally, in a different level, and some of this was mentioned by Caitlin, the US as a global leader in health funding, they recently have taken positions in international fora that isolate sexual and reproductive health as being non-essential. So, and this is not true. The world has agreed over and over again that the needs of women and girls are essential in any crisis. So this interpretation makes it difficult for us to work. So, these are some of the challenges we feel with this positioning by the US government. Over.
Thank you. Thank you. Imogen?
Thank you so much. Our next question is directed to Maliha from Corinne Whitaker. Realistically, even with the call for alternative forms of education, we will face a situation in which a generation of girls and boys will have an education gap. Many girls may never return. In addition to alternative means during the pandemic, can the sector prepare now compensatory programs for girls, for example, education for married girls, education in pregnancy, etc.?
Great, thank you. Yeah, that's absolutely right. I mean, the alternative forms of education aren't going to prevent all the girls from dropping out of school, and we do need to prepare for those things. However, one of the things I will emphasize is now I think is the moment to actually try to provide as much alternative education through radio and accessible forms as possible. Try to do a concerted campaign that focuses on social norms of getting girls back to school, not making it acceptable for girls to drop out of school for a variety of reasons, and urging communities and families and governments to try to do as much as possible to get girls back into school and to keep them in school. We've already spoken about the multitudes of benefits that girls get when they actually go to the regular formal educational channels. And I think, some of the things about, for instance, education for married girls, there's absolutely no reason why a married girl can't go to school unless there's a policy or a social norm or an unsupportive family context in which she can then not get back into school. In fact, there are some countries that have policies that prevent either married girls or girls who've had children from formally re-entering the school system. But what we should be focusing on is taking down those policy barriers. Every girl, whether she's married or unmarried or has children or doesn't, still has a right to an education. When all those things fail, then yes, we should go to providing some forms of alternative education. But our first and foremost focus should be to allow girls to realize their rights to formal, safe, quality education.
Thank you so much, and I'm going to hand it back to London.
Yes, thank you so much, Hemaja. I'm going to ask Corinne's question to Caitlin. And so schools also provide protection through both accountability, such as staff, peers, for detecting abuse or anticipating harmful practices, and through solidarity. What can be done together with the effort to advance education to address these critical elements, particularly significance to health?
Sure, happy to jump in, but Maliha, also this is her specialty area, so welcome her responding as well. But I think, yeah, the intersections between health and education run deep, and for Planned Parenthood, we work with so many schools to provide sexual health education, and that's a critical entry point for young people to learn about their bodies and consent and healthy relationships. So we're very worried about, that, again, a lost entry point to have critical conversations for young people of all ages about their health and well-being. And I'll leave it to Maliha maybe to jump in on any other pieces.
One of the other pieces I'll just mention, and Caitlin, you covered most of it, is the solidarity of girls and their sort of affinity groups, whether that's through just informal friend groups or through safe spaces that often are done through schools, or some things like girl guides or so forth, that allow girls to get together and talk to each other, and through that also get information around their rights, around being safe, around sexual reproductive health. And I think that is, again, why emphasizing the ability of girls to be able to leave their houses, to be able to enter these spaces, whether it's school or it's informal after school services, to then be able to connect with their peers and form these friendship groups, which are just so important, particularly for girls and adolescents, which is the most vulnerable time for girls, because this is where so many life changes are happening and so many factors that affect the rest of their life are going to, we're either going to be able to reach them and prevent the bad things from happening, or be able to reinforce the positive things in their lives. So these informal things are very important.
Thank you very much. Imogen?
Thank you. Our next question is for Veronica. Vivian was wondering, why do pregnant women have to cross the border to access care? And if you could elaborate a little bit more on that.
Yes, because conditions in Venezuela are very dramatic. So there is, there was a survey very recently, but the access to health services has been very much affected. So for many of these women, the only option for having healthcare is crossing the border and coming to Colombia. I hope that answers the question.
Thank you. And I'm going to hand it back to London.
Thank you, Himaja. And this message is for Maliha from Jill. Is the best solution for girls to continue education during COVID with radio programs from ministries of education? More poor families, for example, in Senegal, have easier access to radio than digital options.
Yeah, Jill, you're spot on, which is something I mentioned also. That's why we're emphasizing equitable alternative educational channels, right? Channels that you can reach even if you're poor, even if you're marginalized, even if you live in a remote geographical area that may not have the best connectivity or you can't afford it. So absolutely, in a lot of places, radio is by far the most accessible media channel, but increasingly as our podcasts, people can, sort of compress those, get them on devices that that are able to reach marginalized groups, create groups of people who do that. Another form that is actually also very accessible in many contexts, although not all, is also television. And that also provides you with a visual form of being able to reach students and provide alternative, which is better for slightly younger groups. So for instance, we just did some research and that showed that the digital access for girls in Pakistan is less than 20%. So there's less than 20% of girls can access even anything over an hour of digital technology a day, which is clearly not enough for her education, whereas television access is almost 98%. Particularly the free state-run television channels. And so we are supporting some grantees in Pakistan that are providing, that are digitalizing and using entertainment forms for the government curriculum and getting that onto the government television channel, which 98% of the population can access. And that's what we meant by, equitable alternative means, which are really important. Let's not all jump on the everyone has an iPhone and has unlimited data and so then can do Zooms with their teachers and get an alternative education. We know that's not even true in the US, certainly not true in the rest of the world.
Thank you very, very much. Himaja?
Thank you. So our last question, and I'd love for everyone to comment on this, is we've talked about the struggles that women are facing due to COVID from around the world, but I'd love for you all to talk about how the lives of women in the US are interconnected with the lives of women around the world and why disparities that we see around the world do apply to the US. Oh, and we can start with Caitlin. Thank you.
Sure. I think two things come to mind for me. One is that I think it's a falsehood to act like there's the US and then there's the rest of the world. When I travel around the US, it's so clear that our communities are global. We have a rich tradition, which obviously has been undermined a bit in the last couple of years, but of welcoming immigrants, of refugees. And so when we look at the lives of women in the US, they may have family in other places, they may have come from other places, they're carrying with them traditions. So when we think about things like travel restrictions coming into place, either that the US government has imposed on others, or now as our pandemic is raging, we being restricted from going to other places, that's truly dividing families, women and children, etc. And then the second piece I'll add is that I think the US government as a central actor that impact women and girls both in the US and around the world. We often see the same restrictions put in place both domestically and globally. So you may have heard of the global gag rule. We now have a domestic gag rule impacting women and girls in the US. So I think there are policies that have strong parallels between what's experienced from women in the US and women around the world.
Thank you. And then next, could we hear Veronica?
Yes, I would like to reinforce this idea of interconnectedness. You know, globally now, it's very difficult to isolate from the world. You follow Twitter or you see television, and you're always listening, you know, stories from other countries. And I think empathy can be very important in these times, to put ourselves in other people's positions, to realize how privileged we are to have access to certain things, and how, you know, at the end, the position of the government can be impacted by the people's demands. And so I think it's, as a global world where there is interconnectedness and cooperation, we cannot ignore the pleas of the rest. We need to have them present, and we need to try to contribute to others in as many ways as we can. And we see, you know, some of the countries that did not have lockdown measures, well, people were hearing from the countries that did make, you know, these decisions, and wearing the mask and doing things that they thought they should do, even if their governments were not recommending those things. So I know that's the case of many people in Nicaragua, for example. So just to give an example of that, yeah.
Thank you. And then Maliha?
Yeah, I mean, I don't have too much more to add than what's already been said. I think the interconnectedness of the world is so evident with the pandemic. I mean, it's a pandemic for a reason, right? No one is safe, no matter how much you thought your shores are going to keep everyone else away, and you're not going to suffer from the repercussions of this. But a couple of you know, sort of thoughts that occurred to me to think about, particularly with women. Seema talked about in the beginning what the UN Secretary General said about the need to put women in the center of the recovery efforts. And one thing I'll, you know, put a slight nuance on this. I think women are very much center to the recovery efforts, whether formally or informally, being the vast majority of the healthcare workers in the world. But then also the person, like the family care, the unpaid care that's provided through the family, and women carrying most of the burden for that. I think the real concern, and this is true whether you're a US woman or a woman living in the UK or a woman living in Pakistan or Senegal, women are not at the center of decision making for COVID response and recovery. And what needs to change from that. And I think that is really, really central. That's something that affects all of us. We need to see more women at the center of decision making, so that the responses can be better. They can be better for women. They can be better for girls. And I think that is something that ties almost all of us together in the world. The need to have more empathy and a more trust-based response than we've had currently.
Thank you so much for your wonderful insights. And without further ado, I'm going to pass it on to Seema.
Thank you so much, Imija and London. And so instead of closing remarks from me, I thought what I would do is have one last lightning question for our panel. It's going to be a two-parter. So one last, what's your main takeaway in terms of a solution? And then also, what's giving you hope? I mean, given everything, the degree of the challenges that we're all facing collectively and individually, what's giving you hope? So why don't I start with Veronica?
Okay, thanks. Well, I would say that in the solution is key to consider innovation, but innovation with a gender and human rights approach. So as Maliha was saying, we need to make sure that we reach everyone, and particularly women and girls, with whatever solution we propose. what gives me hope? I'm an optimist, and I'm always looking for, the ray of light in whatever I see. And I think we have seen solidarity in around us, people trying to benefit others who are not as well as I am. And so seeing the pandemic as an opportunity, when people talk about building back better, we have to ensure that we really improve inclusiveness. And also that I think this is an opportunity to put on the front line the importance of having strong health systems. That is something that has become very evident, that those countries that are using science, that have strong public health systems, have been able to deal better with their response than those that do not. Over.
Thank you so much, Veronica, for those words of hope. Let me turn to Caitlin.
Sure. Well, in terms of solutions, I do think, we often in these big moments think only of resources, but I do think there are policy solutions which are critical too. Policies that are erecting barriers from us partnering with the most effective organizations working to combat the pandemic and to reach women and girls like UNFPA, and also those impacted by the global gag rule. So to all of you on the phone, I think one solution is to just use your voice. I work a lot with US policymakers, and I'm always struck by how few of their citizen constituents they hear from on global issues. So I think sometimes people underestimate the power of your voice to reach out, but it really can be impactful either to reinforce good behavior and to thank people for where they're fighting, because it can get tiring, but also to, of course, have a little accountability for those who may be on the wrong side of history when it comes to these issues. And then in terms of hope, and I'm glad we're ending on that note, I do hope that this moment of unprecedented times breeds new creativity and innovation. But I also hope that it pushes us sort of out of sort of the old aid model of thinking that it's about global north helping global south, and really pushes us to think about how are we working in true partnership to really build that we want, the world that we want and need together.
Opportunity, yes. Thank you for that, Caitlin. And Maliha.
Right, so I think this moment is, I saw one of those terrible internet memes, right, which we've all been obsessing about, and looking at because we don't know what else to do. And it was something like, what if 2020 isn't a year that just needs to go away? What about if it's the year that we were all waiting for? In some ways, I hardly disagree with that. I hope this was not the year we were waiting for in any shape or form. But in terms of the disruption it's caused and our ability to pivot and embrace changes that we could never have imagined even at the beginning of this year, much less a little bit earlier, tremendous changes to systems, tremendous changes to the way we perceive our life has to be, and our ability to accept that, I think, is a moment that allows us to create a lot of social, economic, and political disruption and move things light years ahead that we might have been trying for decades to move, that never, it seemed like they would never budge. And I think that is a great moment that we shouldn't lose sight of. It's always at moments of the biggest global disruptions that the biggest social change happens, because the system is so shaken up that we're maybe psychologically, we're already been prepared to do that. And that also goes to my moment of what brings me hope. I think this has brought out the worst in people, but it's also brought out the best in people. You see that in your neighbors around you. You see that around you in governments that have reacted so well and so compassionately, a handful of them, with their citizens. And you see that it's possible, and it isn't about resources necessarily. Kerala, with so little resources, this little state in India, has done so tremendously well, because they had trust, because they put the systems in place, and because they put their citizens first. So I think just remembering these kinds of things bring out the empathy, the compassion, the human in you, and then you can react to a situation in ways that can actually be so positive and bring so much hope to people. It's not that hard.
We're all nodding our heads vigorously, Maliha. And I'll just take the liberty of being the moderator to say, to me, it's like building power together. Also, it's a very feminist approach to challenging and complex issues, and just this panel, all of your organizations, and just the energy of having so many people dialed in today, taking the time to listen and learn and act. We can build power together. We can do this. We have solutions and a roadmap. It's just about the political will. So let me just say thank you to this entire panel for your time. And this is just the beginning. It's just the beginning of a conversation with lots more to do. And I know that our colleagues at UNA will send out some follow-up notes. And I know that we are all available to be in touch with any of the audience to talk about next steps. And on that note, back to Himaja for the final time. Thank you to Himaja in London as well.
Thank you so much, Seema, and thank you all for being here today. As you've heard, COVID-19 has exacerbated many pre-existing problems and inequalities, and introduced additional challenges for women and girls around the world. It might seem overwhelming and daunting to people like you and me, but there is something we can do right here and right now. As an American citizen, you have the power to convey the importance of the right of women and girls to our elected officials. While organizations like the United Nations Population Fund, UNFPA, are on the front lines providing girls and women access to critical reproductive health care and delivering essential supplies to countries who depend on it, the Trump administration has defunded UNFPA for the 4th consecutive year. This dangerous and short-sighted move significantly reduces access to voluntary family planning, prenatal care, safe childbirth, and preventative and treatment services for sexually transmitted infections. So it is so important to let your members of Congress know that UNFPA is critical for women and girls in America and across the world, and restore our financial commitment by pulling out your phones right now and texting UNFPA to the number 738-674. So you can do that now and later on today. And this is just one of many more ways that you can take action as a member of UNA-USA. When you join UNA-USA, you're joining 20,000 other Americans around the country, like me, who know the importance of the UN. I personally joined UNA because I understand that we need the UN to support the rights of women and girls to access healthcare services, educational opportunities, and other important resources to better their lives. So join me by becoming a UN advocate today at unausa.org. And finally, please join us for more GEOS sessions like this, which you can find more information for on our website. Thank you to our incredible panel, Verónica Simán, Caitlin Horrigan, and Maliha Khan, as well as to Seema Jalan for moderating. And finally, a big thank you for all of you joining us today. And with that, I am going to close this session.
Thank you.